Welcome to Never Too Late for Fitness Radio, bringing baby boomers proven strategies and innovative products for getting fit, staying fit, so you can live a longer, healthier, and happier life. Here's your host, best-selling author and fitness advocate, Phil Ferris.
Welcome to our show, where health and fitness professionals provide insights, strategies, and techniques to help baby boomers win the game of life, getting fit, staying fit, and living a longer, healthier, and happier life. Today's show is all about staying in the game. What do I mean by that? Well, to use a sports analogy, if you're a professional athlete, the worst place to be is on the DL, the disabled list. When you're on the DL, professional athletes can't play in the game and must sit on the sidelines. When baby boomers get injured, they also must sit on the sidelines and stop playing the game. Whether it's walking, running, dancing, or tennis, injuries make baby boomers stop exercising. Unfortunately for baby boomers, short stints on the DL often lead to permanent ones. When this happens, baby boomers become less active, less healthy, and often less happy. Just because we have another birthday doesn't mean we must give up the physical activities that we love, but also make us look and feel younger. My guest today helps baby boomers stay in the game, play the game better, and play it pain-free. She provides a winning strategy for winning the game of life. Today's guest, Denise Smith, is owner of Smith Physical Therapy and Running Academy, located in Crystal Lake, Illinois. Denise is an injury prevention specialist, running technique specialist, and physical therapist. With over 15 years of experience, Denise believes that athletes deserve individualized attention to focus on learning how to move properly to avoid injury and improve performance. Smith Physical Therapy and Running Academy also offers balance retraining, headache treatment, and concussion testing. Denise, thank you so much for spending some time with us today.
Thanks for inviting me, Phil.
Well, I'm excited to really learn more about what you do, specifically because as baby boomers age and they continue to stay active, which is a good thing, but unfortunately so do their injuries, their trips to the ER, and also the amount of time they spend with physical therapists. You spent the early part of your career doing traditional corporate physical therapy. How did you decide to start your current practice and focus on injury prevention?
Well, I've seen some changes over the past 15 years in the way healthcare is executed. So there seems to be more of a focus on waiting for injuries to happen and then we treat them. And insurance companies are restricting less and less how that's reimbursed. And they sometimes punish you for getting hurt, or they make it very challenging for you to get hurt. You have to go see your physician, and then your physician has to refer you to something or do some tests first before they'll do anything else. And I thought there has to be a better way to do this. And if we can prevent the injury, then we don't have to spend all that money treating the injury. And as the baby boomers are getting older, they do have a tendency to get hurt because they don't know how to move or how to address an issue if it comes up without running to see the doctor. And so my whole goal is to teach people, empower them to understand if you can make a joint move the right way and support a muscle the way it's designed to move, then the likelihood of an injury happening decreases dramatically. And though insurance companies don't pay for prevention, some employers support that, but a lot of people just take it upon themselves to take that next step and be proactive to prevent something from happening.
That's great. Now, I was reading, and you have a very interesting definition of what an athlete is. And I wondered if you would share that with us and explain why it's so important that baby boomers understand that definition.
Well, yeah, I believe that an athlete is anybody that moves their body for exercise or activity. So I think the society has taught us that an athlete is somebody who does a triathlon or a marathon or exercises every day. And I think that if you get out of your house or get off of your couch and you go for a walk or you go play tennis or you are outside playing with your grandchildren, you are moving, and therefore that makes you an athlete. Athlete it's a skill that you have to learn. Whatever sport you're in or whatever activity you do, there is a skill set that needs to be learned and taught, and that, by definition, makes you an athlete. And baby boomers don't stop just because all of a sudden you hit some, age. Doesn't mean that you have to stop moving. I believe that you have to keep moving to keep moving. And if you still believe and still want to do stuff, I don't believe that an injury should sideline you, especially if it was preventable.
Okay, so by your definition, almost anybody can be considered an athlete, and therefore can benefit from the education and the approach that you take.
Absolutely.
Okay, and I think that's important because, again, moving, what I found in talking to baby boomers that either have maintained their physical fitness or have reclaimed it, movement on a regular basis is one of the key components that led to their success. Now, we know that in your practice you treat athletes of all ages, but today we're focusing on the baby boomers. Why do baby boomers come to you? What are the kinds of issues, or what kind of baby boomer patients do you see, and why are they coming to see you?
Well, a lot of them come because they had a friend that I treated or worked with, and so it'll kind of pique their interest that they've decided to get back into running, or they are noticing with their golf swing they're not quite getting as much range of motion before, or with tennis they're not as quick to recover from an injury, or like if they tweaked something, it takes them a little bit longer. And so they want to see what they can do to keep those injuries at bay or address something before it really explodes. And so that's usually how they find me, is that something triggered them to look me up or to figure out how to prevent it. They'll start Googling and my name will come up with some of the injury prevention stuff that we do here.
So why is it important for baby boomers to understand the correlation between injury prevention and keeping active?
So there's an old Chinese proverb that says you're only as old as your joints. And I think what happens is, for some reason, we've been trained to think that I'm about to turn 40, and everybody says things like, oh, you're about to be over the hill. And I don't know what that means. I don't, from here, my life is just going to go downhill, and I don't buy that. And I'm so tired of having people say things like, getting old stinks. Well, yeah, sometimes we have to change the way we expect our body to respond, but that doesn't mean that just because you got older that all of a sudden your joints stop working the right way. And something like falls are the fear of anybody. You fall and you get hurt, and it's that dreaded hip fracture that you're going to get. But people start falling because they stop trusting their body, and they don't train their neurological system how to respond quickly. And so the more we move and the more we keep moving, the more confidence we have in our body, the stronger we get. And the more we can just convince our brain and our body that there's no reason to stop doing what we love to do. And it adds to our happiness, too.
Yeah, I mean, one of the reasons I play tennis is because I play with, some of the players I play with are still in their 30s, and some of I play with are in their 80s. And I ask them, why do you play? And they say, I love playing. So for them, it's a lifelong sport. I know there are many people that golf is their passion, and they play golf into their 80s, 90s, and beyond. Why? They enjoy it. They enjoy being out, the outlet it gives. And other people are into other activities, whether it be distance running or lifting weights. It is fun, and it does keep us looking, feeling, acting younger. So that's important.
One of my clients told me that she read an article about how the only systems that change as we age are our hearing and our eyesight. And if you really think about that, it's staggering to believe that those are the only two organs or systems that are affected by age. That sets us up for we can still keep doing everything we want to do. You just have to believe and trust in your body and train for it.
Okay. Now, in your practice, you focus a lot on movement patterns. Why are they so important, and why are movement patterns causing baby boomers to experience pain and injuries?
Well, movement patterns are what can either help us or hurt us. I know you play tennis, so there are certain positions you need to get your body in to effectively hit the ball, correct?
Correct.
Okay, so if you are not in a good position and you try to swing at a ball, you're either going to miss it or you're going to tweak something. And so the more you train your body to get into positions quickly and efficiently, the tendons don't have to work extra hard, the muscles have more power behind them, and the joints are able to transmit forces the way they're designed to without just absorbing impact. And so when you learn a good movement pattern, let's take squatting, for example. All of us have been in a hurry maybe to pick up our grandchild or a box that's on the floor, and we just kind of bend over and pick up the box. And then we say, oops, I shouldn't have done that. And you maybe feel it for a couple days. But when we squat down the way we're always trained, and you lift with your knees and not your back, it wasn't really hard to pick up that 20-pound bag of cat food. But you were learning to put your body in a good position to help complete the activity that you were asking it to do, and it wasn't that hard. And so that good movement pattern is what helps you just do your everyday activities just as well and that's just as important as when you're doing physical activities, you're exercising, your hobbies, that you don't get an injury that way too.
Okay. Now, maybe you can explain a little bit about why baby boomers may be more predisposed to having deficiencies in their movement patterns than, let's say, a 20 or 30-year-old.
Well, part of it is that as our body does change, we do have maybe some other disease processes that may be affecting things that we don't have control of. So diabetes, some of those systems are affected because of a disease process. So that puts you at a little bit of a heightened risk of injury. And so by putting your body in a bad position, you may tweak something faster than you would, let's say, if you don't have diabetes. Now, if you're a healthy 57-year-old, no pain, no injuries, no ailments, those movement patterns can change because we stop either doing our activity or we stop trusting that we can do it because we somehow have it in our notion, well, I'm a certain age, I shouldn't be lifting these heavy weights anymore. And so we stop trusting and stop training our systems so that we start doubting the way we can move. So that neurological system that can automatically respond and helps us change our movement patterns isn't taxed as much as it maybe was when you were in your 20s and 30s and you would do pickup games of basketball with your buddies or go to the gym. And we start doubting that we can actually do something because we have this preconceived notion that we just shouldn't be doing it anymore.
Okay. Now, I know that in my personal history is that I played basketball until I was 65, but in my 50s, I broke a couple of wrists, and it changed, it changed the way I had to shoot, so I had to change my game. And then I had back surgery, which changed my gait a lot. And what I found is my body adapted, allowing me to play basketball, but it also had some repercussions in that I started getting more injuries to the ankles, to the knees, and because I was using inefficient movement patterns in order to play something I like in an adaptive form. What I found, what I was educated to learn was that your body's going to adapt. And it may get very, very good at doing something very, very bad for it because it wants to do something. And that can lead to other kinds of injuries, which I'm an example of, because my desire to get back into playing forced me to not adapt the best movement patterns when I was playing. So my ego got in the way. Do you run into that with your patients at all?
Oh, all the time. And it's normal. I mean, that's human nature. Our body, it really is amazing how the body compensates when something isn't working right. The body doesn't want to show that it's not working properly. So it'll move things, it'll shift joints, and then the tendons will start to have to overwork. And then the muscles get irritated. So there's this whole process that happens just to keep us upright. And doing what we love to do. And that becomes a mind over matter thing. But then eventually stuff starts to break down and the tendons start to talk back a little bit saying, I'm trying to work as hard as I can, but I'm not in the right position to do this. And now I'm kind of angry about it. And then our pride gets in the way and says, I can work through this. Or you run to the doctor and the doctor's like, just take some time off. And that's not always an option. And so you want to put yes, there's times when you have surgery and things are structurally changed. Well, then you just have to retrain that new movement system to make sure that everything goes along with it.
Okay. Can you give an example of perhaps some of the patients you've worked with that have gone through, they've recognized the movement pattern and the movement pattern caused injuries and then they were able to correct?
I have this wonderful lady that I work with named Dee, and she is an avid runner. She helps train half marathon groups through the local running store. She is an inspiration to everybody, but she had a bad fall, and she tripped over the curb. It wasn't like anything happened, but she tripped, and it scared her. And after that, she started, even with her running, you could see she would just start shifting everything backwards as a way of like, okay, if I don't go forward, I'm not going to fall. I'm just going to keep leaning backwards. And what ended up happening was she started getting hip pain and shin splints and plantar fasciitis because now all of a sudden either she's standing or she's running or when she would squat down, she would shift all of her weight backwards. We call that a posterior weight shift. And when you start moving everything back, it's almost like if you are to start falling forward, which is key to running, is being able to get your body weight forward, you end up asking the system to almost stop forward movement. And when that happens, the system doesn't know what to do, and it starts reacting slower. So if she starts to trip or fall, instead of her being able to step out and quickly catch herself, she would then fall again because now all of her weight is shifted back and she can't react and catch her weight. And so once we got her confident with, okay, it's okay to fall, we had to practice reaction time. We had to practice quickly stepping out and catching yourself. We had to practice being able to quickly turn on a dime and those kind of things. Once she retrained her neurological system that it was okay to get your weight forward and to start tasking it to do that and to get past that, it's scary to ask yourself to try to fall. But in a safe environment, your brain needs to do that. And so once we got her able to get her body weight forward again, she was able to start running better, and her running form changed. And she was happier because now she could actually run without the fear of falling. And she could go play out in the yard with her grandkids because she wasn't afraid of tripping and falling, when they were playing ball. So just that, you have to start slowly because it's a scary thing to make your body start shifting weight and doing it quickly. But once she learned that, okay, I'm going to catch myself if I fall, I don't have to be afraid and start leaning backwards, then the system moves better because now the front of the body is being loaded equally to the back.
Okay. So let's say I'm interested in learning more about injury prevention. What are some of the basic elements of your program, and what can a patient expect, once they get in your office?
Well, we start with a video analysis because I think if you ask people how they move, they'll tell you, well, I do, especially runners, I'll say, where does your foot land in relationship to your hip? And they'll say things like, well, it lands right underneath me. And then we film them and we can see that they're overstriding, that they're landing way out in front of them on a locked knee and a locked ankle. And so I think what we perceive and what is really happening are two very different things sometimes. So we always start with video analysis so we can actually see what we're dealing with. And then starting to look at other people's video, people that move more efficiently. What are they doing and how do we get you to that? because I think when we start recognizing movement patterns, we can start trying to implement it on ourselves. And then there's the actual task of doing the drills to help improve our perception. Once we understand how we should move, feeling it is the next step. And it's hard. It's hard to change a bad habit. I think we all know that and experience that in different aspects of our life. But especially trying to change a movement pattern is really, really hard. So it's drills and exercises to help us be stronger and practice retraining that neurological system to understand how to create a new pattern of movement.
Now, you talk about doing the video analysis, and it sounds like you're sharing it, you're working with the patient to look at that, so that they look at it with you. Why is that important for the patient to have that, look at it through your eyes as well?
I think that when somebody else analyzes what you're doing, it's always very humbling. And it's easy to blow something off, to say, well, you just filmed me for 2 seconds. I don't always move like that. Well, no, you're right. Maybe you don't. But it's just a snippet. And we have to start somewhere. And so when you have someone start to break down those types of things with you, like this is just a starting point. And these videos, I can email to them, and they can go back to them, and they can learn how to film themselves. That's the whole point, too, is I want to empower people to learn how to film themselves, so they don't always need me. The goal is, that's why we call it an academy here, is that I want to teach people how to move better. And when you learn what you're looking for, you can film yourself from there on out and say, oh, I was slipping back into that old habit. I do need to, go back to some of those drills because I was going back to my old pattern. And being able to recognize that is key to that.
Okay, so the reason is to not only to fix them or correct them, it's also to enable them to do it themselves. So they have the ability to recognize in themselves, and probably in others, good and inefficient movement patterns, so that they can understand the cause and effect between. Now, you mentioned if someone's overstriding. What are some of the implications if someone's overstriding?
They'll start getting things like IT band pain or knee pain or plantar fasciitis or Achilles tendonitis or shin splints. Overstriding is this awful thing that for some reason when we see it in magazines, people think that's normal, but really that's the worst thing people can do when they're running is overstriding. And I think once you know that is bad, you're going to start seeing runners do it. And again, that perception of being able to recognize movement patterns, you'll slowly start watching people as they run by you, like, oh, that guy totally is overstriding, or whatever you're starting to notice because you've seen it and now you can recognize it.
Are there other common movement patterns that you see pretty frequently that would apply to a baby boomer?
I see it a lot in golfers. Now, my husband is an avid golfer, and I'm just learning. But when I watch some of these people golf, and it is mostly baby boomers, but I think you see it in other people too, the lack of hip mobility. Your hips are your powerhouse, and so a lot of people try to overswing because they're trying to power through just using their upper body. And this can be applied to any sport that involves a racket or a golf club or something that you're swinging or hitting with, because your hips, the more momentum that you get through your hips, the more that power is going to translate through your extremities. And so getting that power behind your hips and getting your hips to move the right way, getting the joints to move and getting the muscles to get that power behind them just helps set you up for success.
So you mentioned a lot of skills and drills and things to do to improve the movement pattern, to get people's body to, reprogram themselves. Can you give some examples of the more common drills that people do and how it helps them to get better?
Well, if we talk about runners, a lot of that is just working on landing underneath your hip. So we use simple things like jump roping or skipping or running backwards. And if we're going to, because then you're focusing on just landing and what it feels like to have that reduced impact through all of your joints. If we're going to talk about a sport like tennis or basketball or golf, it's retraining the hips and shoulders to help out instead of hinder you. A lot of times we lock out our shoulders, especially with runners too, actually. We have a tendency to lock our upper body out. And you need to have your shoulders help you get the rest of your body moving. They act as like a puppet strings. If I can get my shoulders to move, everything will go along with it versus locking that down. So we do a lot of throwing with a ball, but not being able to bend your elbows and throw with your wrists. That people have to actually try to learn how to toss a ball only by pushing up through their shoulders, which is really awkward to do the first time you do it. But you have an 8-pound medicine ball in your hand, and you have to learn to shove that ball up into space only using your shoulders. Or if you're doing like a little curb hop where you're hopping up and down on a 2-inch curb, not swinging your arms necessarily to get your body up, but learning how to just use your shoulders to shrug up and pull your body weight up. So using the big joints and the big muscles we have to help us versus always relying on kind of these swinging motions to get the power.
Okay. Now, the types of exercise, they have to do them only in your office, or are they the types of things that they can do at home?
It's mostly at home work. Usually people are only with me for 45 to 60 minutes, and they get all of their exercises and drills emailed to them in a PDF so that they can snapshot it and put it on their phone and have it with them when they're out. I mean, the key to this is practice. Right. And it's great when people are standing in front of me because they're motivated, but I really want to empower them to do this on their own because it's hard. I mean, it is not easy to learn how to move different, and it takes effort. So, I mean, it's like anytime you learn something new, you have to practice at it. And so people don't always want to do that work, but that's the goal, is that when they have the tools to succeed, then it's up to them to just keep doing it outside of my clinic.
Now, Denise, every fitness health program has stumbling blocks or roadblocks that people run into. What are some of the biggest obstacles your patients experience working towards achieving their goals, and how do you help them overcome them?
Well, I think it's easy to slip back into old habits. But to break a habit, you have to create new ones. And so I think the obstacle that people experience is that it feels different and it feels funny, so they just stop doing it because it's not comfortable. And we have to be able to push ourselves out of our comfort zone a little bit sometimes to train our bodies to move better. So I think it's that feeling of frustration that will stop people. I mean, I know how I feel as I'm learning how to swing a golf club. It's easy for me to just try to get back into some old swinging habits, but that's why my ball slices every time to the right.
Right.
So when I actually listen to my husband and do what he's telling me, and understand that he's trying to teach me how to move, the ball will go straight, and it's amazing, and it feels so much better. There's no jarring. There's no, all those I don't get pain in my elbow. It feels much more natural, but it takes practice for me to do that. And it takes a little bit of humility to sit back and have somebody coach you and, not want to get defensive. So sometimes just letting yourself be taught and being coached is hard. But it's humbling, but it can result in great things.
I guess it really comes down to how important is it for that person to get back that movement that they were looking for, whether it be how important is it for them to get back in the game that they want to get into, whether it be tennis, running, gardening, dancing. If that's important, then you've got to make the investment to retrain your body so you can continue doing it for a long time. Otherwise, you're going to have repeat visits to the either the ER or the physical therapist and having, the same kinds of issue show up. Okay, now your approach to treating patients and working patients is different than the way a typical doctor might. Can you explain the difference and why it's important that baby boomers understand the difference?
Well, we have this movement that we're trying to do in our industry. It's get physical therapy first. Because these poor doctors, they're under such high demand that they don't always have time to sit and help you figure out why you have something. They just want to treat your symptom. So they want to get you a pain pill or a steroid or give you a cortisone injection or send you for an MRI or an X-ray. And it's simply because they don't have time to sit and help you figure out the cause of the dysfunction. And so as physical therapists, that's what we're trained to do. We look at why there's this compensation happening. So we treat the dysfunction. So, injuries, bad things happen. There's trauma, you fall, things happen. So those injuries are just rehab. And like I said, there's sometimes that there's disease processes that start to break down our muscles and tendons, like diabetes. So the injuries that we really try to focus on are these misuse injuries. I think for a long time, the terminology was overuse. And I don't believe that there's like a magical number out there that all of a sudden we do an activity 100 times and that now is going to topple us over because now we've overused it.
Okay.
I think it's more of a misuse. If your hips aren't in the right position and you are trying to pick up your grandchild, you're going to tweak your shoulder. So you need to learn to square up and get close to the 2-year-old and pick them up using the right mechanics instead of trying to just like cheat the system and do what's quick. But if you keep doing that over and over and over again, eventually the tendon is going to be like, hey, this hurts me. And then that's when injuries start cascading into something worse. So we have to stop and look at what is actually driving the problem here. And once we tackle that, then usually all the symptoms you feel go away.
Now, it's a little bit of the chicken and the egg here in that if most people are conditioned, I don't go seek help until I have a problem or I have symptoms, and yet the best remedy is to avoid having them in the first place.
Right.
So how do baby boomers recognize, it's probably time that I go to a running academy and learn how to run again, or whatever it is, the preventative aspect of that. What's the trigger that they should be looking for to say, this is where I need to start focusing on prevention so I don't end up an injury waiting to happen down the line?
I would say with runners, what I hear the most, what finally gets them into the clinic is that, and this is regardless of age, actually, they will have a running-related injury, and they'll have tried everything, compression stockings, kinesio tape. They'll have tried everything, and maybe the injury will go away for a little while, but it always seems to sneak back. And that's when they're starting to recognize, okay, something isn't working right, and my next option is I'm going to go see a doctor who's going to tell me to stop running. And that is not an option. Or they've already been told to stop running, and they finally go back to it, and the injury comes right back. They feel great when they're not running, but as soon as they go back to their activity, it comes back. And so that pattern is, I think, applicable to anything. You really want to be outside gardening, but it hurts every time you kneel. And so you try some different positions, but really you got to get down there and pull those weeds out. You need to get on your knees. And so if they rest and they don't do it, then it goes away. But as soon as they go back to it, it comes back. And so people will start to recognize like things are getting worse and worse and worse. And so that's usually where they'll come in to me. Our big push right now is that we want people to come in just once a year, just do an annual visit. It doesn't, it can be with any PT. A lot of PTs will do these annual health and wellness visits that, okay, let's look at how everything is moving. Let's look at your strength. Let's look at your joint mobility. Let's look at your balance. And are we starting to see anything break down? Because now let's head it off. Here's what I want you to work on at home, in your gym, in your daily life to help prevent that.
Right. It seems like, what you're saying is also what I've experienced is the first, warning shot is I'm going to get some pain that is different than the normal pain I get when I do an activity. And being a guy, I've been taught to kind of ignore it and just work through it, as opposed to saying, wait a minute, this is a signal that something's not quite working right. And if you don't address the cause of that pain pretty quickly, it's going to turn into an injury or something more severe that will take longer in terms of recuperation and rehabilitation. So just listening to your body and say, hey, this is not the way I want to feel after I've done whatever that activity is. Maybe I need to, invest some time to say what's causing that, because it's not normal. And again, most people I've talked to, they'll say, yeah, I knew it. I was hoping, and then it didn't. And then it's a lot. Then we spend 6 months in recovery as opposed to maybe a couple of weeks in doing some strength training and balance training. So.
And I think for people that are trying to reclaim their fitness, if it's been a little while, we sometimes don't know the difference between soreness, which is a good thing, or pain. And so if you're getting back into working out, finding a PT that specializes in movement retraining is key, because they're going to teach you, okay, this is what good pain is. This is when your muscles are sore a couple days after, but you're able to still move. It doesn't stop you from moving. You actually feel better when you move, versus as you're moving, pain is getting worse. We've all had those experiences after we've lifted a little too much when we go down the stairs. We're like, ouch, 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 ouch.
Right.
It doesn't hurt the joint. It doesn't hurt, it doesn't hurt specific. It's just kind of like your whole muscle is sore. But the more you do it as the day goes on, you feel better and better. And then the next time you do that same workout, you're not quite as sore. So if you're reclaiming your fitness, it's really important to understand what good pain is versus bad pain.
Okay. What are the most common or frequent comments that you hear from clients after they've completed your program and achieved their goals?
You mean like a good comment or a bad comment?
Yeah. Well, you can share both.
A lot of people, after they've left me, will say, I stopped doing it. I just, if you weren't there telling me what to do, I didn't do it. And that's always disheartening to me, because I clearly didn't find a way to empower them to want to make that change. And so, finding that motivation, I think, is something I need to do really well and connect with everybody. But when they do it, I'll hear things like, it's so nice not to have pain. Like, I'm so happy, I've increased my mileage, or I'm just, every week I run 10 miles and I feel really good in my 10 miles. I don't hurt, my joints don't hurt anymore. And so those are the comments that just make me so happy that people can go back to what they love to do without pain. If I can help one person be able to, drive that 6 hours to go see their children, and they get out of the car and they don't have pain because they've been working and strengthening, whereas normally they would get out of the car and limp a little bit, that makes me so happy, because I know that they learned how to care for their own body.
That's really great to hear. At least many of my listeners don't live in the Crystal Lake area, and then they still want to improve their running form. Can you still help them?
Yeah, we can do. The beauty of technology is that there's so many ways to communicate now. And so we do virtual training as well. And we use all free software, so people aren't having to invest a lot of money to do this. We use things like Skype and video analysis software called Huddle that we email back and forth to each other, that I can see how you're moving. You can see me, especially if we're Skyping, sometimes that connection is important too. And so virtual coaching is the new thing, and it's a great option for people that don't live here. And I just hired a specialist who specializes in concussions and headaches, and she even uses it with her clients too. She treats people that are in Ohio that maybe have undergone a concussion, because she can do a lot of her testing. As long as she can see their eyes and answer them questions, she can then tell them what to do. So technology has, yes, it's hurt us in a lot of ways, but it's actually helped us in a lot of ways too, especially in the medical profession, with being able to treat across state lines.
So no matter where you live, and if you have an interest in improving your running form, you have an option for them.
Yes, absolutely. It's a very cheap option too. You don't have to spend a lot of money to do a lot of this stuff now.
That's great. Now, Denise, if people want to connect with you or get more information about Smith Physical Therapy and Running Academy, where should they go?
Our website is probably the best place to start, and that's smithptrun.com. So Smith, PT as in physical therapy, and then running, RUN, smithptrun.com. That's a great place to start. We also have a ton of information on our Instagram page and Facebook page under Smith Physical Therapy and Running Academy. We feel that the more information that we can provide, the more people will find the motivation to keep doing these things. So those are good places to check us out too. And you can always call our office if you're local too.
All right. Well, Denise, thank you so much. This was very informative, very helpful. Again, I think it applies to any baby boomer that wants to be active. If they want to sit on the couch and work with a remote, obviously you're not the first person that's going to be on their speed dial. So this is something that, if you want to be active and stay active and be pain-free so you can continue doing it longer and better, you gave us some great information, and you're a great resource for people. So thank you very much, and have a great day.
Well, thanks, Phil, and thanks for what you do for everybody.
All right. Have a great one.
You too.
You've been listening to Never Too Late for Fitness Radio, hosted by Phil Ferris. To learn more about the guests or resources on our show today, or to listen to past episodes, go to nevertoolateforfitness.com.